The vestibular cochlear nerve is the eighth cranial nerve. This nerve is more commonly referred to as the auditory nerve because one of its primary functions is to mediate auditory information. The auditory nerve is a sensory nerve that conducts two special senses, audition and balance. It consists of two distinct parts, the vestibular branch and the cochlear branch, both of which are concerned with the transmission of afferent information from the inner ear to the central nervous system. Implications for communication can result in poor auditory acuity, as well as difficulty in expressing and understanding oral communication. This can act as a huge barrier for speakers as well as the listener. No form of hearing aid for the amplification of sound or cochlear implant may help. However, the auditory brainstem implant can still be an option to consider. If a person cannot hear, he or she may also have to resort to ASL to communicate with others. The eighth cranial nerve is located in the brainstem, where the pons and the medulla are. The nerves for hearing are located in the two cochlear nuclei, specifically the inferior cerebellar. The equilibrium nerves are located in four vestibular nuclei, which are in the pons and the medulla oblongata. Vestibular nuclei project to the spinal cord, cerebellum, thalamus, and cerebral cortex. The nucleus of the auditory nerve is located in the brainstem at the junction of the pons and the medulla. As mentioned earlier, the eighth cranial nerve has two parts, the vestibular branch and the cochlear branch. The vestibular branch innervates the vestibule, semicircular canals, utricle, and saccule of the inner ear. The nerves in this region are sensitive to changes in the position of the head and the impulses they initiate as passed into the brain as reflexes to assist in maintaining balance. As for the cochlear branch, the nerve for hearing impulses from this region and pass through the pons into the temporal lobe of the brain for interpretation. The two nerve branches of the vestibular cochlear nerve join through the internal auditory meatus. When properly functioning, the vestibular branch of the eighth cranial nerve controls balance and sense of movement in space. It transmits information concerning acceleration and position in space to the bipolar cells of the vestibular ganglion within the internal auditory meatus. From within the pons, fibers branch to synapse in the nuclei of the pons and medulla, as well as directly to the flocculonodular lobe of the cerebellum. The cochlear branch of the eighth cranial nerve mediates auditory information. The cochlear nerve, along with the sensory hair cells of the inner ear, transmit auditory information to the brain. Information concerning acoustic stimulation in the cochlea is transmitted via the spiral ganglion of the bony labyrinth. To summarize, the vestibular cochlear nerve transmits sound and equilibrium information from the inner to the brain. Damage to the eighth cranial nerve may arise from a number of causes including fracture, nerve compression, disease, or vascular incident. Damage to the vestibular component of the eighth nerve may result in disturbances of equilibrium arising from the loss of information concerning position in space. More specifically, damage or traumatic injury to the vestibular nerve results in nystagmus or vertigo. Vestibular nystagmus is an uncontrollable rhythmic oscillation of the eyes. Vertigo is a subtype of dizziness in which an individual inappropriately experiences perception of motion, particularly spinning motion. Damage to the cochlear branch of the eighth cranial nerve will result in ipsilateral hearing loss, such as deafness or tinnitus, reflecting the degree of the trauma.